An arrhythmia is any variance in the heart rhythm, and they could vary pretty dramatically. People could come in with anything from extra beats, which they might notice, which might originate from the upper or lower chamber, to sustained rhythm problems that could be very symptomatic or even life-threatening. Atrial fibrillation is a particular type of arrhythmia, and in atrial fibrillation, the upper chambers, the atria, develop a very high-frequency electrical signal. And in effect, the atria don't contract like they should anymore, and they are, in essence, quivering instead of contracting effectively. The signs and symptoms of atrial fibrillation vary. Some people can be completely asymptomatic of atrial fibrillation. Other people can develop very serious symptoms. They might develop marked shortness of breath. Some people might even go into heart failure. People can feel like they might pass out, or they might actually pass out. The majority of people with atrial fibrillation sense it as a racing, irregular heart rhythm with very disturbing palpitations while they're having it. Atrial fibrillation, in part, is related to age. So as the baby boomers are hitting those ages of 60s and 70s, we're seeing the incidence of atrial fibrillation go up dramatically. The other thing that is increasing the numbers of atrial fibrillation is that we're living longer. People with hypertension have a very high association with atrial fibrillation. People with valvular heart disease, so you may have heard people with leaky mitral valves or stenotic aortic valves, and all of those increase your risk for developing atrial fibrillation. And then there are some non-cardiac reasons for people to develop atrial fibrillation. So people with thyroid disease can develop atrial fibrillation. Atrial fibrillation clearly can be caused by sleep apnea, and we are seeing more and more of that. There's also more things in the literature coming out that treatment of sleep apnea can actually help treat and maybe prevent some of these rhythm disturbances that we're seeing. We know that heart problems can be hereditary. So hypertension is hereditary. Hypertension can lead to atrial fibrillation. So indirectly, there are some other hereditary factors that might increase your chances of developing atrial fibrillation. The most serious consequence of atrial fibrillation is a stroke. It continues to be a large source of strokes in the United States and the world population. And part of that reason is because many people walk around with atrial fibrillation and don't know they're in it. The other serious consequence of atrial fibrillation is that when you're in this rhythm, you tend to go faster than your normal heart rate would demand. And that could lead to blood pressure issues where perhaps people are getting lightheaded or passing out. It can also lead to heart pump dysfunction where their pump is not contracting as well. And because of that, they develop marked shortness of breath, exercise intolerance, even congestive heart failure in some cases. People who drink alcohol heavily or take a lot of stimulants or abuse certain drugs are at a higher risk for developing atrial fibrillation. Even if people live a very healthy, fantastic life, as they get older, they're still at some point going to develop heart disease and still will have an increased incidence of atrial fibrillation. If you could put it off for 20 or 30 years, though, that's certainly an advantage in your life.